joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're joined today by the Deputy Mayor of London, Josh Morgan, and the Associate Medical Officer of Health for the Middlesex-London Health Unit, Dr. Alex Summers. We'd like to welcome the media who are in attendance for this afternoon's briefing and invite them to submit their questions using the question forum here on Microsoft Teams. We'd also like to welcome those tuning in this afternoon on Rogers Television, Rogers Facebook page and YouTube channel, those listening on News Talk 1290 CJBK, and those watching on the CTV London website. We'll get to the opening statements right away, and we'll start with the Deputy Mayor of London, Josh Morgan.
Well, good afternoon. This is another significant day in our nearly 18-month-long effort against COVID-19. As of 12:01 this morning, we entered step 2 of the Ontario government's province-wide reopening plan, and it's another positive step towards a return to eventual normalcy. I'm extremely optimistic that despite the expansion and reintroduction of various services and types of gatherings, that we'll continue to maintain an upper hand on the virus, just as we have all the way through step 1. You'll remember we started that phase on June 11th. At that time, provincial case counts were just over 500 per day, and as of today, they are now under 200 and still falling. We've seen similar declines here in London Middlesex over that time, and what's most encouraging, we've seen a significant ramp up when it comes to vaccinations. I know Dr. Mackey made mention yesterday that over the last 8 days, we had 50,000 people vaccinated in London Middlesex. That's an incredible achievement. And what's more, it seems entirely likely that given our supply of vaccine, that pace can, at the very least, be maintained over the coming days and weeks, possibly even accelerated. If you haven't got your first shot, please book your appointment today. If you haven't rebooked your second shot to get it done faster, I urge you to do so as soon as possible. It's something that I actually did myself, and as a result, I'm getting my second dose 74 days sooner than I had originally scheduled. As we enter into step 2, I'd like to close by encouraging everyone to shop local, tip generously, and donate to local groups and charities if and when you're able to. We're certainly still all in this together, and as we continue to work together, we'll continue to pull through this pandemic. Thanks.
Oh, Dr. Summers, you're just on mute there.
Indeed, I am. Thank you. Good afternoon, everyone. As always, I bring greetings from Dr. Mackey, and good to be with you this afternoon. As Deputy Mayor Morgan indicated, we are entering step 2 of the Reopening Ontario strategy, effective today. As we enter step 2, you'll see additional opportunities to dine outdoors, to get a haircut, potentially needed by myself, admittedly, and engage in more activities. But one thing that we do want to highlight as we enter step 2 is that this pandemic is not yet over. As you enter step 2, we're asking that you, as much as you can, keep it outdoors. Indoor risks are much higher when it comes to the transmission of COVID-19. So we're asking people to strongly consider keeping things outdoors as much as possible. The warmer weather is in our favor. Let's take advantage of it and spend that time outdoors. For additional information on what changes in step 2, as well as the importance of keeping outdoors, as always, feel free to check out our website. The provincial websites also have additional information on all the changes to the restrictions that are now in place as a result of moving into step 2. One of the other reasons for caution as we move into step 2 is the increasing predominance of the Delta variant in Ontario and in the Middlesex-London region. The Delta variant is much more transmissible than the variants and the garden variety COVID we've seen to date. This means that for people that are not vaccinated, the risk may actually be higher to be infected, particularly if we move indoors. We've seen in other countries in the world an uptick in case activity despite vaccination because of the Delta strain. And we're watching that very closely here to see if that might unfold. And that's one reason why that minimum of 21 days occurs between each step in the reopening, to make sure that the additional reopening does not result in an increase in cases in our region. So we'll be watching that closely. A few other announcements as we move into step 2. Starting today, the MLHU COVID-19 dashboard will be updated Monday through Friday, and not on health unit holidays. So we won't have a dashboard refreshed tomorrow, but we will have a dashboard on Friday. And then there won't be a dashboard refreshed on the weekend, but starting on Monday and through the summer, it will be updated Monday through Friday. On Mondays, we will also be providing a breakdown by day of cases over the course of the weekend, so you'll be sure to see what has transpired moving forward. And the reason for this change is with some of the lower case counts, we're making sure that we're focusing on the weekly trends, not just the daily trends, and ensuring that we're able to support other health unit responses as well. And so this is a helpful move in that direction. We wanted to also provide some clarity around the day camp guidelines and requirements now that we're in step 2. Day camps are permitted to be open as we move into step 2. However, it's important to highlight that day camps still have to abide by the other restrictions that are relevant, which means, for example, indoor sports. Indoor recreations and sports are not allowed in step 2. Therefore, day camps can't have indoor sports that happen. So day camps, you can have arts and craft indoors with distancing and masking, but indoor sports are not permitted even at day camp. So we just want to highlight, we know there's been some uncertainty around the requirements there. We're delighted that day camps are up and running, but no indoor recreation or sport at this time in indoor camps. We'll look towards step 3 to see if that will be permitted at that time. A few last reflections as well. We wanted to highlight that over the course of the COVID-19 pandemic, there's been significant impacts on mental health, particularly for families. For parents and caregivers, there's been an increase in depressive symptoms, anxiety, alcohol intake, conflict with partners. And the challenge with all of this is that we want to ensure that mental health is important on the minds of all of us as we enter the summer. For children and youth, over 70% of them aged 6 to 18 have experienced an increase in at least one mental health concern, be it depression, anxiety, irritability, hyperactivity, attention deficit disorders, and almost 67% of 2 to 5-year-olds have experienced an increase in at least one area, like I just mentioned. The pandemic has been difficult for many people, for all of us. If you, your partner, your friends, your family have experienced changes in mental well-being over the pandemic, you're not alone in that. And remember that kids too can have mental health challenges. Please pay attention to what's going on with your mental health as we enter the summer, and take efforts to reach out to some of the resources that are available. Those are available through our website. They include Marymount Family Support Services and Crisis Center, Child Reach Parent Connect, Vanier Children's Mental Wellness, and Craigwood Children, Youth and Family Services, as well, of course, as the Health Unit. You can always give us a call at the Health Unit and we'll direct you appropriately. Lastly, I just want to comment that tomorrow's Canada Day, and it is a reflective Canada Day for many of us in light of the ongoing tragic legacy of colonization, particularly the abuses and lost lives in residential schools that have affected the lives of all Indigenous people and affect all of our lives as well. We do invite all to reflect. I'm wearing my Downey Wenjack pin today, a foundation and fund that is working to increase awareness and knowledge around truth and reconciliation. We encourage all to take some time to reflect and educate on truth and reconciliation. We've got some links through our social medias and on our website, mindful that this truly is a reflective Canada Day. Thanks as always for joining us. With that, I'll pass it back to Beth and to any of the questions that are on the line.
Thanks very much, Dr. Summers and Deputy Mayor Morgan, for those opening statements. We do have a few questions in queue here, but I would remind the media that certainly if you do have any questions, please get them in that question forum as soon as you can. I know there is a bit of a delay, so getting them in as soon as possible, we'll make sure that we get them answered this afternoon. We'll start with the first one here. It's from Steve Young with CTV London and News Talk CJBK. It is for you, Dr. Summers. Dr. Summers, are you concerned areas like Kitchener-Waterloo that aren't moving into stage 2 will result in people coming to our region to eat and do things like getting their hair cut? What, if anything, can be done?
Thanks for that question, Steve. Certainly, we know that disease activity is slightly different in other regions in the province. Here locally, our case counts have dropped substantially, although as I mentioned, they have plateaued somewhat, and we're watching the Delta variant closely. We are, regardless of where people are moving across the province, we are strongly encouraging people, as I mentioned, to keep things outdoors as much as possible. If you are not fully vaccinated, make sure you, as quickly as you can, make an appointment like Deputy Mayor Morgan, to get that second dose. We know that the Delta variant is highly responsive to 2 doses of vaccine, and so we encourage you to do so. If you are not fully vaccinated at this time, please keep things outdoors as much as possible. And when we look at other regions, we are monitoring the Delta variant activity in those regions. And one of the reasons why I highlight our concern around the Delta variant is because of what's going on in places like Kitchener-Waterloo, where the Delta variant has resulted, particularly amongst homeless and underhoused people, resurgent in cases. So we're watching that very closely. We're working with partners to ensure that our population is vaccinated as quickly as possible, including our homeless and underhoused population, to do our part to try and limit transmission. For us in our region, keep things outdoors, get yourself vaccinated. Those are the things that we can control regardless of what is happening in other regions. Thanks for the question.
Thanks very much, Dr. Summers. Our next question comes to us from Matthew Trepethick with AM 980 CFPL. Dr. Summers, this question is for you. The health unit announced it will no longer be updating the dashboard on weekends or holidays. What does this signify about the state of the pandemic in our region?
Thanks for that question, Matthew. Yeah, the move to updating the dashboards Monday through Friday only does highlight that the third wave of the pandemic is beginning to abate. It's beginning to come to an end. And it allows for us as a health unit to focus our resources on things like the vaccination campaign and some of those other non-COVID activities which have been put on pause for a while. It does indicate that the pandemic is resolving. It does indicate that the vaccination campaign is working very well and we're making tremendous strides. And it's a reminder that we're still going to be updating that dashboard Monday to Friday. We are still going to be following these case counts very closely. And as always, if urgent changes arise over the weekend, you can be sure the health unit will let the public know and will be in contact with the media should there be a dramatic change in outbreaks, case direction, etc., regardless of whether or not it's happening on the weekend or not.
Great, thanks very much for that response, Dr. Summers. That leaves us with no questions in the queue this afternoon. So a short and sweet media briefing this afternoon. Thank you very much, Deputy Mayor Morgan and Dr. Summers, for joining us this afternoon. Thank you to the viewers and listeners tuning in this afternoon as well. We will be back to join you on Monday, July 5th at 2 o'clock. So until then, have a great afternoon. Thank you.